Dear viewers, tobacco-related diseases is a three-part series in Prescribon Medical Education series. This video is part 1 in the series. See related videos, two-part series on tobacco and two-part series on basic functions of the respiratory system in Prescribon Medical Education series. Pathology of smoking. Cigarette smoking, CS, continues to be a major health hazard, and it contributes significantly to cardiovascular morbidity and mortality. Both active and passive, that is, environmental cigarette smoke exposure, predispose to cardiovascular events. Cigarette smoking increases inflammation, thrombosis, and oxidation of low density lipoprotein cholesterol. Cigarette smoke exposure increases oxidative stress as a potential mechanism for initiating cardiovascular dysfunction. Dear viewers, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Physical and biochemical properties of cigarette smoke. Conventionally, cigarette smoke is divided into two phases, a tar phase and a gas phase. The tar or particulate phase is defined as the particulate material with a size of more than 0.1 micrometer. The gas phase is the material that has particle size of less than 0.1 micrometer. The particulate, that is the tar phase of cigarette smoke, contains more than 10 power 17 free radicals per gram. The gas phase contains more than 10 power 15 free radicals per puff. The radicals associated with the tar phase are long-lived, that is hours to months. The radicals associated with the gas phase have a shorter lifespan in seconds. Cigarette smoke that is drawn through the tobacco into an active smoker's mouth is known as mainstream smoke. Side stream cigarette smoke is the smoke emitted from the burning ends of a cigarette. Mainstream cigarette smoke comprises 8% of tar and 92% of gaseous components. Environmental tobacco smoke results from the combination of side stream smoke 85% and a small fraction of exhaled mainstream smoke 15% from smokers. Side stream cigarette smoke contains a relatively higher concentration of the toxic gaseous component than mainstream cigarette smoke. Of all the known constituents, nicotine, a component of the tar phase, is the addictive substance of cigarette smoke. Cigarette smoking and atherosclerosis. Cigarette smoking predisposes the individual to several different clinical atherosclerotic syndromes, including stable angina, acute coronary syndromes, sudden death, and stroke. Aortic and peripheral atherosclerosis are also increased, leading to intermittent claudication and abdominal aortic aneurysms. Vasomotor dysfunction, inflammation, and modification of lipids are integral components for the initiation and progression of atherosclerosis. These components precede the apparent structural and clinico-pathologic manifestations of atherosclerosis. Effect of cigarette smoking on atherogenesis. Vasomotor dysfunction. Impairment of vasodilatory function is one of the earliest manifestations of atherosclerotic changes in a vessel. Both active and passive cigarette smoke exposure were associated with a decrease in vasodilatory function. Cigarette smoke exposure impaired endothelium-dependent vasodilation, that is EDV, in macrovascular beds such as coronary and brachial arteries, that is arteries supplying the upper arms, and in microvascular beds. Nitric oxide, NO, a free radical, is primarily responsible for the vasodilatory function of the endothelium. Cigarette smoking was associated with decreased nitric oxide availability. Not only is nitric oxide a vasoregulatory molecule, it helps regulate inflammation, leukocyte adhesion, platelet activation, and thrombosis. Therefore, an alteration in nitric oxide biosynthesis could have both primary and secondary effects on the initiation and the progression of atherosclerosis and on thrombotic events. Inflammation. The inflammatory response is an essential component in the initiation and evolution of atherosclerosis. Cigarette smoke causes about a 20 to 25% increase in the peripheral blood leukocyte count. Cigarette smoke is associated with an increased level of multiple inflammatory markers, including C-reactive protein, interleukin 6, and tumor necrosis factor alpha in smokers. Local aggregation of leukocytes on the surface of endothelial cells is an early event in atherosclerosis. Elevations of various pro-inflammatory cytokines increase leukocyte endothelial cell interaction, leading to leukocyte aggregation. Modification of lipid profile. Cigarette smoking could promote atherosclerosis in part by its effects on lipid profile. Smokers have significantly higher serum cholesterol, triglyceride, and low-density lipoprotein (LDL) levels, but high-density lipoprotein is lower in smokers. Insulin resistance is a potential key link between cigarette smoke and cardiovascular disease. Cigarette smoking also increases oxidative modification of LDL. Cigarette smoke and thrombosis. Cigarette smoking is associated with an increased incidence of acute MI. Cessation of smoking significantly reduces this risk over a 1 to 3 year period, with an exponential decline approaching the risk in ex-smokers within 5 years of cessation. There is an immediate reduction in thrombotic events with smoking cessation. Cigarette smoke increased the risk of plaque rupture and acute thrombosis of a lipid-rich, thin-capped atheromatous plaques. Acute cigarette smoke exposure may also increase coronary artery vascular resistance, reducing coronary blood flow. Smoking may also be a risk factor for coronary vasospasm. Platelet dysfunction. Platelets isolated from smokers exhibited an increased tendency to aggregation. Alteration of antithrombotic and prothrombotic factors. Smokers have higher fibrinogen levels that correlate with the number of cigarettes smoked. Note: fibrinogen is a protein produced by the liver. This protein helps stop bleeding by helping blood clots to form. Furthermore, higher red blood cell counts, blood viscosity, and an ongoing inflammatory process potentiate the prothrombotic process associated with smoke exposure. Alteration in fibrinolysis. Cigarette smoke is associated with dysfunctional thrombohemostatic mechanisms that promote the initiation and or propagation of thrombus formation and limit its effective dissolution. Factors and mechanisms responsible for smoking-mediated vascular dysfunction. Cigarette smoke contains over 4,000 known components, of which only a few components have been examined in isolation. Polycyclic aromatic hydrocarbons found in the tar fraction of cigarette smoke accelerates atherosclerosis. Nicotine in cigarette smoke is probably the most studied component. Although nicotine plays a major role in smoking-related increases in cardiac output, heart rate, and blood pressure, its role in cigarette smoke-related atherothrombotic disease remains controversial. Nicotine, at concentrations similar to a smoker's blood level, has a minor effect on the initiation or propagation of atherosclerosis. Nicotine is the known addictive substance in cigarette smoke, and its addictive qualities likely perpetuate exposure to the other more detrimental components. Dear viewers, this is the end of part 1 in the 3-part series on tobacco-related diseases. For the other videos, see Prescribon Medical Education series, Tobacco-related diseases.